A human being so true.
Waiting for a go from my engineer, we can get going.
The real place.
Okay, we're also streaming live on YouTube on the Streaming University Project channel. Okay, so I guess we're ready to go. I'd like to welcome everyone to the COVID Answers webinar, sponsored by Grant Houses Resident Association, the Internet Society, and the Streaming University Project. I'm going to hand it over to Mr. Davis and let him introduce our guests. Carlton.
Yes, how you doing? And we have Department of Health. That's Mr. Padmore John. Is he there?
Hi, everyone. How are you doing?
All right. It's good to see you.
Thank you very much for the invite. Thank you very much for the invite. We appreciate the opportunity to speak to your folks, to you and everyone in the houses, and even further afield, because we know that other people will be listening as well. So thank you so much.
Yes, indeed. We're definitely going to get this information out because a lot of people are talking.
That's right.
I wish we was in a position where we can hold a meeting. We probably wouldn't be able to hold the amount that'll come. 100 people, but when I'm in the streets, I just got in. That's where we had a lot of people talking about COVID-19, and he wants some answers. And then we have Mr. Victor Edwards.
Good afternoon, all. I'm here representing Community Board 9. Good evening to everybody.
All right.
And sure. Carlton, if you don't mind, I just want to introduce one other person as well that was able to join. And you know her, Laureen Valentine from H+H, who's been working with the Test and Trace program.
Yeah, she looks very much familiar. How you doing?
How are you? Good evening. I think you see me out there handing out masks and information on COVID-19 where people can get tested. I'm with the Test and Trace Corps.
Yes, and Grant is a unique place to start with. It's the top of the list for public housing. So I've done my little research. How you doing, Sherry? Can she hear me? Oh, she's not on here. All right. Sherry and Antone.
Anton, Sherry, one of my co-board members from the Internet Society.
Yes.
Harlem chapter.
ISOC.
ISOC.
All right, that's what's up. We need this closeness right here in order to branch out because as I feel, COVID is not going nowhere anytime soon. We may have light at the end of the tunnel, but we got some long ways to go to discipline ourselves according to what I gathered from listening to Dr. Fauci and Dr. Chosky, all these different Dr. Burks. And it's like more like we gotta have a good health pattern going on nowadays. Good food eating. We gotta stay away from processed food. We gotta get out the box with processed food and start going to the markets now. And if we're already doing it, continue. But we're changing ways over here in Grand Houses since the COVID started with our Fresh Direct, where all the fresh fruits and groceries and good nutritional foods has been coming through Grand Houses. Now, what I found out about COVID-19 when we had the 22 deaths COVID related was that majority of them were essential workers. And there's a big thing now about essential workers still suffering and kind of being swept under the rug as far as being noticed, as far as the not just the work they're doing, but how they're getting ill too. And reason this is called coronavirus COVID-19 answers because we like some people to respond to some of these questions that are being doled out, like the statistics. You know, they have the statistics out where, you know, a confirmed total of 878,702 cases up to date as we speak since 5:08 p.m. local time. A total of 36,300 deaths. So we need people to come to have these answers coming from others that are in the community and have knowledge and suggestions about the statistics. If you need me to diversify, you know, my answers, we're talking Black, brown communities and the European communities, the white community, and how are we interacting to a point where that is just becomes how would you say, it has no color barrier, it has no boundaries, anything. Can somebody answer that? Jerry?
Yeah, I heard you. I think the question you're asking is that is there any barriers to COVID-19? No, it's going in all communities. Can you hear me?
Yes.
Yes, we hear you fine.
It's in all communities. It's in it's hitting everyone. But I think what's key is that as you mentioned, CARLTON, is the reaction or the capability of some communities to be able to and their resiliency. How strong are they able to withstand what's happening? And we all know that we as African Americans have been through a lot in this country. And it does so many things that we can keep on being resilient to. And especially as you indicated, a lot of our diets are not as good as they should be. And that's because of food insecurity. That's because of some, you know, when folks are getting a certain amount of dollars each day, and they're trying to stretch that, mom and dad trying to stretch that dollar, they try to, you know, get as much as they can, and sometimes it's not the most nutritious or the most beneficial to our families. So we have been put in a very very precarious position for not just today, for many years, decades, and centuries. And that has little by little whittled us down, where it's a little bit easier for us to succumb to a lot of the stuff that happens in this country. And typically you hear that the terminology, when America gets a cold, African Americans get pneumonia. And really that this is another case of this. COVID-19, unfortunately, does not, you know, it does not go by race. It does not go by economic class. It does not go by, you know, your location, your neighborhood, where you live. It goes to everybody once it's passed from one person to the next. What we hope to be able to do together with Laureen is, one, to be able to identify resources that are in our neighborhood, so that we can make our community much more stronger. That's one. And then being able to ensure that we have the information at our fingertips so that we can make better decisions in how to protect our families, protect ourselves, and be able to ensure that, you know, something like this does not happen to us again, and we're in a better position. And of course, there's so many things that we can do, but there's a lot of stuff that policies have to change, politics have to change, and it's for us to ensure that those requests, those demands keep on reaching the different folks that make the decisions, so that it is a little bit easier and better for us moving forward. So
I think Padmore, to add on to that, you know, Mr. Davis hits a really good point where we're talking about food insecurity, housing insecurity, and specifically where we can talk about health insecurities and inequities in our communities of color. you know, right now we're hitting the holidays, and we're hearing this term COVID fatigue. I know something that's big in the Latino communities, and what we're seeing in the nature developments is a small uptick, but nonetheless an uptick in numbers in COVID cases because of the small gatherings that folks are doing in their homes, right? Because we're not gathering outdoors anymore, it's too cold. And so when we're talking about the numbers, specifically what we've seen in the 7-day period in the 10027 zip code, specifically where Grant houses are, we have seen some great folks doing vigilance. They've been vigilant, washing their hands, getting tested, wearing their mask, staying home if they feel sick, but we still have a 1.85% positivity rate in that area. And so what we're doing for, you know, non-pharmaceutical intervention, what we can control, right, what's within our means aside from our diet, is that making sure that folks have access to basic needs such as masks, because we're reaching the point where folks rather spend the dollar on milk and eggs than on procuring masks, and they're reusing masks, and what they're doing is getting themselves sick constantly. And so that's why you have us doing these action days, and you know, we're oversaturating these populations. And right now I just got off a call about strategic planning for nature houses, specifically because folks are together, not because the positivity rate we're seeing it moving around, but because we're living so close together, right? We're taking the elevators, we're taking the hallways, and making sure that we're disinfecting and sanitizing it, but also making sure that folks have what they need in the interim with the mask. And we're really concerned about what the numbers are going to look like in the next 5 days after Christmas, because of these small gatherings. And it's really up to us as community leaders to say, hey, I know you're tired and you want to see your family and this is hard, but how do we work together to combat that? And that's something also that we need to talk about, what we do have control of here.
All right, Vic, can you elaborate on statistics?
Vic, I think you're on mute.
You're on mute.
To answer your question, no, I can't elaborate on statistics, but I did have a question for Laureen, and that is, as far as masks, which types can be reused and which cannot? We know we gave out masks at Community Board 9 on 3 different occasions, I think, on 125th and Amsterdam. I think you were at that one. We did 145th to 135th, and we did 125th in general with the surgical, what I call surgical type masks, the blue masks. Can those be reused? That question was asked of us.
No, so it's not recommended for them to be reused. What is recommended to be reused are the cloth mask, right?
Right.
That they're washable, because what we're learning is that we're picking up so much stuff from outdoors. Once you use a mask and you're outdoors, you're running your errands, you come back inside, you should throw that away. You shouldn't use it again, pick it up for the whole day. You really shouldn't be doing that. And also, you know, we're finding, I mean, for folks like Padmore and myself that are doing outreach constantly in the field to protect ourselves, where if you see some of us double masking, it's
Right.
because we, you know, we're in high positivity populations where we want to mitigate the virus. We try to stay socially distanced away from folks, but really to reuse that blue surgical mask, or even we're seeing folks putting it inside out, it's not going to be conducive to mitigating the virus for you contracting it at all.
Okay, so that's a word we'll pass along. I mean, many people only have the masks that we have given them when we were walking. We asked people, so they just figure that's what I have, that's what I'll use, but we'll try and pass that word out. I mean, we can't, unfortunately, we can't supply everyone who needs a mask with a mask to do every day. So I guess, like you said, a cloth mask, and continuously wash it out to you know, clean out anything you might have picked up along the way. We'll definitely pass that along. The other question, maybe for you and Padmore, it's a big question, and CARLTON as well. Any ideas on how to get our younger people teenagers to wear masks. As I walk Broadway and 145th in Amsterdam, I pass young people all the time hanging out like nothing's going on, and this day and age, unfortunately, you can't speak to all of them. Ones that I know, I'll give them a heads up, but other ones, I'm not as young. I don't fight as hard as I used to, so I don't want to, tangle with the young guys. But what I've told them is it might not affect you, but you take it home to a relative that might be compromised or an older person that might be compromised, and they'll get ill. And sometimes it gets across, sometimes it doesn't. And this, look like we're still in it for the long haul. So just try to be vigilant on these type things.
I mean, that's a great point. Where I'm working with H&H right now to see what we can do. We have some ideas on the table to see how we can use social media and the influencers to assist with that, because really, nobody wants to hear it from your mom and dad, right? Or your auntie and your uncle, but they hear it from their friends. They'll hear it from their favorite hip hop artist or, dancer, things like that. So we really are working towards community engagement. I would say that you're bringing up a really good point. What we're seeing now during the surge of the second wave is that the younger folks 35 and under are being impacted immensely. And that's where the uptick in the positivity rates are right now. That's where the uptick in the hospitalization rates are right now. It's the younger folks. So really, how it's impacting them and how we engage is, the continual communication right now, but really we are trying to work on creative ways to ensure that they get it, right? That the messaging is there. And maybe it's not what we're saying, it's how we're saying it. And so we definitely are working together to go back to the drawing board to ensure that all New Yorkers remain safe and that they realize how important it is and to be a leader at this point, what their responsibility is.
Okay. Yeah, I just wanted to echo some of those points that Laureen made, and just the fact that there was I was looking for it as Laureen was speaking. I couldn't find it, but I hope to be able to get it a little bit later and put it in the chat. There was a great article that was recently put out a few days ago by ProPublica, and the article speaks to how a significant amount of African American men are losing the fight to COVID-19. And these are not 50, 60, 70 and more, right? These are younger in their 30s and 40s. And what's important about that is the article makes the statement that how it uses the analogy of John Henry. The legend, John Henry, born with a hammer in his hand, strong as a young child, and then throughout, as he gets older, he is pit against a machine, and they're supposed to dig a tunnel, and which one comes through first, right? And John Henry wins, but we also know what happened to John Henry. He dies after that after he's won the competition. And I think the point it's making is that in order for young people, especially those from our communities, to be able to be successful, they go through a great deal of barriers, have to jump through and over many hurdles for them to be able to succeed, especially for those that are, overachievers, right? The ones that want to get into college, the ones that are entrepreneurs, that want to start their own business, the ones that are, taking, having some responsibility in the community. Those are the ones, that will be responded to during these times, as the article says. So I think it's important for these young people to realize that when you, you mentioned it, Victor, in a sense, that it's not just your health now that you are addressing. It's the health of those folks in your community. And the folks that you could be impacting by not using that mask is some of those same people that you want to go to for help when things are getting dicey, whether it's for money, whether it's for a job, whether it's for a connection, whether it's for, whatever it may be. Some of these same, gentlemen, young Black men that you're going to look up to, that you want to be able to get the support from, they're not going to be there because of the fact you decided not to wear a mask. And that's a simple solution, right? We're not asking you to buy it. We're not asking you to go anywhere and get it. That's why we want to be able to, and I'm happy that Laureen is there, to continue being able to be that resource to the community, to be able to continue ensuring that, you know, we will bring another 2,000, 4,000 masks to make sure that the community has it as much as possible. Where we can get reusable masks, we will. But if we can't, and when we give out, we're not giving out one to each individual, one mask, especially the ones that's one-time use. We're giving out like between 5 and 10 for each person, so that they have a little stack of masks that they can use for a couple of days, right? And as much as possible that we might be able to do that, encourage other partners to come in. That's what we're looking to do. But I think the message here is that, you know, again, it's not just about us, it's about our community, and every little thing that we do to protect ourselves also protect our community, and they have to realize the part they play in that.
Okay. That's a good point. Thank you.
Sherry, do you have any input on statistics? No. Oh, she might not can hear me. Dr. Norm?
Yeah.
Do you have any input on statistics?
Well, I've enjoyed this quite a bit because it's very enlightening. But I have to say that I disagree a little bit about this, where COVID spreads or where it becomes the most difficult and life-threatening. And that is that primarily in Black and Latino communities, the spread is higher. It of course doesn't discriminate; it'll get everywhere else too. But there are several things that make the community, along what Padmore John was talking about, much more susceptible. Some of it is just demographics and geography. We tend to have people concentrated in very dense urban centers like New York City, and we're all breathing on one another all the time. Sometimes we have sharp elbows because of that in normal times, and that puts people at risk. They're also dependent on public transportation because they don't have the wherewithal for the private vehicles. That's an enormous, petri dish to be in. And then we also look at socialization patterns. The Latino community in particular, you get multi-generational households where abuela is there and the aunt is there and the young great-grandchild is there. And it's a beautiful thing. But unfortunately, you have multi-generational households which are very easily infected and in very concentrated conditions, so that it spreads very fast. It's very hard to keep it, especially with a respiratory virus like that. Mm-hmm. And then we also get down to, we talked about diet. That's a big issue. But the most important one that I've seen that's come out recently is 80% of all COVID patients and deaths, it's uniform, suffered from vitamin D deficiencies. And this in particular is very important for the Black community and also for anybody with dark complected Hispanics because of the problem with vitamin D. We live well above the 35th parallel, so we don't get enough sun. And and the melanin you have in your skin that protected you from skin cancer is keeping you from getting enough UV to generate enough vitamin D on your own. And I know a very robust man in this panel, CARLTON Davis, who practically dropped dead because of a vitamin D deficiency, and he eats very well. So if you can get up to about a 5,000 IU supplement for most of these people, you're going to find out that, we also know pretty well that vitamin D deficiencies make people extremely susceptible to respiratory infection. So the flu, colds, SARS, which is what this is, all of the coronaviruses. So if we can, and that's very, very inexpensive. You can get vitamin D tablets for practically nothing. You can get them by the bucket full at with a Costco. You take 2 of those a day, you're going to have more than enough. But that's particular to that, that particular ethnic demographic because of because of skin color. So they have unusual risks in this case, and that's why I don't completely agree that COVID is equal opportunity. It's unfortunately very unequal opportunity in who it decides to go and really clobber. So that's my observation on this. As for the other part of this about the social issues, that's important. It's not cool to wear a mask, and I've seen that around uptown and also down here at where my wife and I live on 100th Street. We'll find that the young Hispanic and Black men just do not want to wear a mask because they think it makes them look like a sissy. That's what we used to say in Peoria. I don't know if they still use that term. They don't want to look like a girl, all right? So they want to show how tough they are. So the problem is that when people like Victor, and Padmore, you can help a lot because guys like you, that I'm certain that there are young men in the community look up to you if they know that you think it's a good idea. That will be a big help. But the other one that I'm worried about now is the vaccines. The vaccines are out, and I'm hearing people who don't want to take the vaccine because they think for some reason we just went through a big political, demolition derby. And some people were trying to say because it comes from one administration that it's not going to be good and has to be checked. And that just simply isn't true. And so these vaccines are safe, and we have to encourage people to take them, because if we don't do it, we're going to be stuck with this for a long, long time. And I can go more into what the procedures are as to why it doesn't matter if President Trump is President Trump or if it's President Biden. The approval process is independent and goes its own way. But I've talked enough, so you guys go ahead, because I'm learning a lot here.
So I like to just confirm before I ask about what we're going to get into, vaccines and treatment. But I'm going to tell you, vitamin D, if I didn't go to the doctor and have my appointment at the time I went, and I got one of those Russian comedic doctors with the strange, funny voice that you see the guy from Bad Boys. Hey, let me tell you, look, man, you got to do this and you got to do that. Let me tell you something. My vitamin D was down to 10. 1-0. Bones clicking and clacking. And I felt like I was about to drop at any given time. Big guy too, 235, 240 or whatever. But when I went to the doctor and got my vitamin D, he gave me 50,000 to take one in every week. Take one for I think 12 weeks. And I'm gonna tell you, by the time I got to the 4th and 5th week, I could run through a brick wall. So yes. Yes. I'm sorry, I got a little reverb, but we are lacking in the nutritional factors that...
You're tuned in to GHCR.NYC, Grant Houses Community Radio, home of the Community News Service and the soul of the Upper West Side.
Great. We need to go back into natural. Start heading to the farmers markets, Whole Foods, and we need fresh food in our system, just to keep a natural flush out of mucus, phlegm. You get a lot of phlegm. That's how you know the buildup. Soup and teas that in the wintertime that we used to drink back in the days, we don't do it no more. These are things we got to get back into it. Everybody, you got to cleanse your system, because this is a wake-up call for everybody. I don't care how rich. We said that already, don't want to be redundant, but I'm telling you, it doesn't even matter. If you ain't taking care of yourself, this thing will knock you down 6 feet. This is a very dangerous. I've seen the guy on the news as I'm scanning for information, and see he died right there on television. And the guy that gave him CPR, now he's contaminated. You know, so yes, it is real. And we're gonna go to the treatment and vaccines. We get a little bit into that about the coronavirus with RNA virus that cause diseases in mammals and birds. You know, in humans and birds, they cause respiratory tract infection that can range from mild to lethal. So I would like to ask for some answers from our participants who are knowledgeable. That what do you know about the contracting of animal to animal, animal to human, and human to human? Padmore?
Carlton, I do have, I'm sorry, I have to jump off at 6, but I have a presentation that I have. It doesn't necessarily jump into so much in terms of the transmission from humans to animals, but it kind of goes into a little bit of what the Department of Health is expecting to do and what it's seeing and around the vaccine. So I can present out that. I won't take too long with that. And then I can open up for questions if but anyone else that may want to add anything. So
I would be appreciative.
Okay, I'm just gonna go to my screen. Okay. 1 second. So just wanted to go over this briefly. And this is some of the stuff that we spoke about earlier in terms of the numbers, in terms of where things are, and specifically around what's happening across the city. And we have seen that, you know, over the last 7 days, everything, you know, the number of confirmed cases, hospitalizations, and deaths are all increasing. All the reason why, as Lauren was saying, that we continue to, you know, use a PPE to protect ourselves. Social distance, wash our hands, sanitize when necessary when we're going out in public, to either wear the mask or social distance. So everything that we have been saying continues, and you know, right now there are a certain amount of folks that are starting to get the vaccine, but as we'll see later, there's a very specific folk, and it's not across the board in the city as yet, or in the country as yet. So still a need for us to be aware of some of these numbers, as you were talking about, Carlton. And one of the key things, you know, of course, is what's happening in our neighborhood. What's really good is that 10027, as Lorena had mentioned, is at 1.83%, relatively low in comparison to the other parts of Harlem. There still is a significant amount of new individuals that are getting positive. That's at number 56 down there. So we want to make sure that this is happening that we continue to be able to protect ourselves and give information to our communities so that they're taking the correct precaution. What's really good also is that this 945, right? This means a lot of folks from the neighborhood are getting tested. Carlton, I know that there is a relatively close proximity and testing site at the old Broadway site. I'm hoping a lot of the folks from Grant are using that, but there are also some others around. And these are different ways of you being able to get contact and to find out where you can go. But it's really important that we just ensure that folks have means and methods of going to getting tested, and so that they have an idea where they stand. I have been tested numerous times at a variety of locations just to make sure, for me and for my family, for that ease of mind. And so in reference to the vaccine, these are some of the things that we're going to be going over. I think we always want to start with equity and hesitancy. There's a lot of people that have been speaking about the need for equity in being able to distribute this vaccine. As someone was speaking, it has hurt and impacted various communities more than others. Not only that, but there's a historic legacy of the way certain communities have been treated and disinvested over time, which have led them a little bit more susceptible to the impact of COVID-19. And furthermore, you know, just still today, There is ongoing policies that serve to destabilize and allow easier for such pathogens and such diseases to have a serious impact in our community. So one of the key things in terms of the distribution of the vaccine that the Department of Health wants to be held accountable for is how it's doing that in an equitable manner as possible. So as we go into the vaccine, these are some key terms. We want folks to be aware of. Immunity, it basically is a protection from an infectious disease. Vaccine efficacy, I know a lot of folks have probably heard that on the television. They're hearing something of 94%, 95%. What exactly does that mean? It just basically says that, what percentage of the people that took a vaccine and how many of those people that took the vaccine did not get infected, and we'll go into this a little bit further down, but it just shows that some of the results have been pretty positive in terms of those numbers. An antibody is a protein that is made by a person's immune system to fight an infection. Pathogen is a disease, and this is where, in terms of where it's coming from, being transferred from an animal to a human, is that pathogen, a disease-causing organism, a virus, a bacteria that somehow gets transmitted from one individual or from animal to a person. And then an antigen is a part of a pathogen, causes the body that makes to make antibodies. So just a basic breakdown of what are vaccines and how they work. So when a new pathogen or a disease enters our body, it introduces a new antigen. And so for every new antigen, our body needs to build a specific antibody that can grab onto that antigen and defeat the pathogen, right? And so one of the key things about COVID was that we had nothing in our body that could grab onto COVID-19 because it had very, very unique spikes. I know that's a protein that everyone is talking about, when they show the pictures, the spikes that was on the, so our body had nothing inside of it or never was introduced to anything like that to create that antibody. So it could not hold on to it. It could not break it down. It could not destroy it. It could not defeat it. So that's why COVID-19 went rampant in our bodies. So what the vaccine does is basically it teaches your body how to create an antibody that can hold on to that vaccine. And that's really important because once you're able to hold on to that vaccine, you can go about defeating it. So, and we'll go into this a little bit more. Not all the vaccines that are coming out are made from mRNA. The first two that have come out, Pfizer and Moderna, are mRNA vaccines. The others are a little bit more typical, where it's a denatured component of the virus that is used. But in this case, it's an mRNA vaccine that's being utilized. So basically, the genetic material enters your body and it tells the person's cells to make a protein that is unique to the virus. And that protein specifically is the outer part, the spike per se, that allows the antibody to grab onto the virus. The proteins produced to tell the body to make antibodies and defensive white blood cells that are then used to destroy the infected cells. And I'm sorry. And if a person is later exposed to COVID-19 in the body, they now are able to recognize the virus and produce the antibodies and cells to fight it. And I think that one of the very good analogy that was used is that the mRNA is much like an email. That email has instructions for your body to tell it what it needs to do, how to build this protein, how to recognize it, and then how to defeat it once it comes into your body. But what's really good about that is that it's almost like one of those emails that deletes or is deleted once you've read it. It's like a Snapchat. Once you've read it, once you've seen it, it deletes. So that's what happened to it. So it doesn't remain inside of your body. It does not stay there to have any ongoing impact. So I'll stop there and I'll just move on. So there are many stages towards developing a vaccine. Each of these phases, as you can see, has an increased number of participants in the vaccine, in the trials. And at a certain point, and of course, each of those phases, there are safety monitoring that's happening. And when it reaches phase 4, which is where now 2 of the vaccines are, Moderna and Pfizer, they're able to be distributed to the public. What's key about the 2 of them is that even after they're being distributed to the public, safety and monitoring is still ongoing. And so these are the variety of agencies that are conducting safety and monitoring of the vaccines that are currently out, that are being used. But there are also state agencies that are going to be doing this. Department of Health is going to be doing this. Universities such as Columbia is also conducting trials. So there's a robust, multi-layered, multi-level system of safety and monitoring that is ongoing. It's not just by the federal government, it's not just by the city, but it's federal agencies, cities, state, private institutions as well that is doing safety and monitoring of the vaccines. So the COVID-19 vaccines, there are 6 vaccines that are currently under development. 2 of them, as I've said before, have been completed. They're being given what they call emergency use authorization to be utilized within the public. We have these, and I just want to let everyone know, a lot of this information is being updated very quickly, and our slides sometimes are not caught up to what's happening on the ground, but we will also always be coming up and coming back with updated information. But at the time of this slide deck being created, the Moderna vaccine had not received emergency use authorization. Since then, it has received emergency use authorization. It has been distributed to a variety of states and cities in the country, and they're starting to inoculate individuals with both Pfizer and Moderna. But the other vaccines that are still in the phase 3 trials, Oxford, AstraZeneca, Johnson & Johnson, and the Novavax. And as you can see, they're not using the mRNA, but different ways of getting that information to your body about the need to build up its immune system. But just wanted to, and we'll get these for the other vaccines as well, but for the Pfizer mRNA vaccine, what we do know is that over 44,000 people participated. Approximately 30% of the participants were from communities of color, and approximately 45% were between the ages of 56 and 85. And going back to that efficacy, the vaccine efficacy for Pfizer, it was at 95% in terms of being able to prevent individuals from getting COVID. Found out that there was no serious concerns, but there's a need for 2 doses for the vaccine, for the Pfizer vaccine, with a gap of 3 weeks between them. For the Moderna vaccine, there were over 30,000 participants. Approximately 37% of them were from communities of color, 3,000 from Black African individuals who identified in that way, and 6,000 from Hispanic or Latinx. And there were 23% that were of the participants were over the age of 65. And for this one, the vaccine efficacy was 94%. There were no serious safety concerns found. And again, it's 2 doses for the vaccines with at least 4 weeks apart. We do not know for the other vaccines that are in phase 3 of the clinical trials yet how many doses will be needed, whether it will be 1 or 2.
May I ask a question about your slide?
Mm-hmm.
When they're saying that the vaccine is 94% effective, is that based on the 2-dose treatment?
Yes, it is a 2-dose treatment, right?
Okay, thanks.
Mm-hmm. So for the vaccine planning, in terms of, I think everyone wants to know, once I take the vaccine, do I still have to wear my mask? Do I still have to social distance? Right? If I got it, if I had COVID-19 before, should I get the vaccine? Yes, you should. Yes, you should still continue wearing a mask. Yes, you should still continue practicing with the call for. And yes, if you did have it, you should look to get it within a certain period of time. So it's important that as much as possible, also that you get the first and second dose within the time period that it is stated. So just to ensure that the vaccine is meeting its efficacy, because that's the way the vaccine was trialed, and that's the way everything was done. So if we had to start having different time between the vaccine doses or just one dose, we are not sure what's going to happen in terms of protection to the community. So what do we know? You know, there is some mild to moderate reactions, and I know everyone has heard about the allergic reactions that has occurred once some folks have taken the vaccines. So, which is why one of the ongoing messaging that we are going to be providing is that everyone speak to a healthcare provider prior to you taking the vaccine, especially if you have a multitude of medications that you are taking or have a history of allergic reactions. There are going to be a variety of hotlines to be able to reach out to medical providers as well. But if you do have a medical provider that you typically go to, make sure that you converse and have a conversation with that person about taking the vaccine. But one of the things that does happen when you take the vaccine is the way that we demonstrate that the immune system is starting to respond to the vaccine is that you do start, you may get a slight fever, some joint pains and headaches, because that means this the message of the mRNA in the vaccine to tell your body that it start creating the proteins and to be able to recognize the proteins, that started to happen. And that's how COVID-19, once you've been infected with COVID-19, some of the same things that happen. And so this is what we're seeing, but basically your body now has the tools to be able to prevent ongoing infection from this and be able to defeat this new virus that's in the body, if you do get it. But what we don't know is that, you know, how effective the vaccines will be. In essence, how long is the immunity going to last for? Again, this is very new, and there's going to be a lot of monitoring, ongoing studies to see some of the impact. And also, there were no clinical trials, at least for the Pfizer vaccine. They did not do clinical trials on children under the age of 18. For the Moderna vaccine, we did not do clinical trials for the children under the age of 16. So it's very important that no children under the age of 16 at this point in time should be getting the vaccine, because we just don't know what impact it will have, whether it'll be effective or not. At subsequent times, other studies will be done in terms of being able to, with children under the age of 16. But at this point in time, no vaccines were done. So the Department of Health right now, together with the state and this is starting to build a timeline in terms of getting the vaccine distributed across the city, across the state. Part of that is being able to have enough of a supply to be able to meet the demand that will be there. So this is all ongoing. There are vaccines that are being shipped into the city at this point in time that are being utilized primarily for frontline healthcare workers, but there are other lists that are being developed for priority populations that will also be expected to receive some of these vaccines. So this is just what New York City and New York City is. And also, yeah, part of the determination of the prioritization of who is going to be receiving the vaccine, the CDC has created something called the Advisory Committee on Immunization Practices. And they are the ones that basically are stating and indicating which priority populations should be receiving and where they are in the list. So it's very important that New York City and New York State go along with this, but we're also making sure that there are a lot of priority populations in New York City, and ensure that they are getting this as quickly as possible if they so desire to receive the vaccines. So some of the individuals who will be getting it first are healthcare workers, people in nursing homes and other long-term care facilities, other healthcare workers, for example, non-FDNY EMS. You can see some of these EMS companies that are not affiliated with FDNY, that are private institutions, and they'll need some of this as well. Essential workers, I know this is one of the points that was made in terms of people being unable to physically distance. So there will be a priority for those individuals. And then people at high risk of complications due to the fact that they have underlying medical conditions. So as indicated, so there are some groups that won't be able to receive it, specifically those under the age of 16, but also individuals that may have some complications with the vaccine. Again, that's why we are encouraging everyone to have a conversation with their medical provider. And when will it be so much that in the distribution system that everyone will be able to get it? That wouldn't happen until the middle of 2021. So throughout that time, it's going to be making sure that there is appropriate messaging going out to give people information about the decision that they can make. There will be mechanisms to get that information out. There'll be ways of ensuring that questions and concerns that of the community are being responded to. There's working with community-based organizations, working with trusted partners, trusted messengers, much like this radio station and others that have the ear of the community, and the community often listens to, and whether or not it's just another opportunity for us to be able to deliver information and for us to get feedback from that information about some of the things that they may do. And where will you be able to get it once it is there? Of course, you can get it from your healthcare provider. We'll also be able to get it at the community and hospital clinics, pharmacies, and urgent care centers. The medication, the vaccine was created under a federal program so that it was at no cost to many of the developers. So again, it'd be at no cost to any individual, whether or not you have insurance, and is also will be available to individuals regardless of the immigration status. So that's very important because we want to ensure that everyone who wants to get this vaccine has access and is able to do that. I'll stop there, and if there are any questions, I'm happy to respond.
I have a question, Padmore. Great presentation, a lot of information there. I had received a text or email, I guess about a week ago, of someone claiming that one of the side effects was facial palsy from one of the vaccinations. You know anything about that?
That's not something I have heard of, but I do not want to dismiss. Well, the thing is, we want to cut through a lot of misinformation, disinformation that is happening, but at the same time, we also want to make sure that people, when they have questions like this, that they feel they are getting legitimate answers. I haven't heard of that, but I definitely will take it back and reach out to some of the folks within my colleagues in the Department of Health and see what that, and that's facial palsy you indicate.
Correct. Yes.
Right. Yes. And so so we will. But I'll definitely find out.
Okay.
Hi, Mira. Would you
Yes,
you have
sir.
any questions that can be answered over the COVID-19 situations that are going on? Oh. Hey, Javelin.
I also want to say that if there are no questions now, that's fine. But I also want to just make sure, one, that folks feel that when they do have a question, Carlton, if you want to field that question and send it on to me, I'm happy to respond. But I want to make sure that folks, and there are different mechanisms that the Department of Health will be building out where individuals can go on a particular website. And even I also put that website in a link to get the latest information on the vaccines, but also to be able to send in questions, send in concerns, and for us to be able to respond to it. I think it's very important that everyone feels empowered to be able to ask questions and know that those questions will be answered.
That will be great because we're about to launch a stewardship campaign where we will be going through all 9 buildings and we collecting data on cleanliness. And that clean environment mentality, we're going to be asking questions also if people need masks or sanitary cleaning. Or we may clean the floors, spray it down with the extra ingredients, I call it, that we received from Dr. LaFond and the military from State Senator Brian Benjamin. We still have some cleansing agents that we preserve. We have extra masks that we did preserve. My treasurer, Michelle Davis, hold back, some instead of just flagrantly giving it all out, just randomly. We gave out in a structured manner, and now we have access to go through our developments for our people and make sure that they can have masks for their whole entire family.
Excellent. That's great. That's great.
Can I ask you a question before you always the good ones disappear right away. You never get enough chance to ask all the questions you got. So my question is, when they originally did the testing, they identified certain areas which they prioritized because they felt they were sort of bellwethers on the most susceptible communities. And one of them obviously was elder care.
You're tuned in to GHCR, Grant Houses Community Radio, home of the Community News Service.
Okay, and they identified public housing as that as well. So, but is it not included in the vaccine distribution to prioritize public housing?
Yes, I mean, so, and that's when there was another question that asking if we can get a copy of this. One of the things is that this information is constantly being updated. So that if I'm to give this to you at this point in time, it will be a little bit old. One of the key populations that we have identified is NYCHA developments. So there will be a specific messaging to ensure that everyone knows any questions that they may have, concerns, to address those concerns and questions, and then 2, being able to ensure that there is an efficient method to be able to get vaccines to individuals that are living in NYCHA as they want it.
Okay, thank you.
Yeah.
You have any other questions? Mira, Sherry?
Well, Marie has some questions, but her mic is not working. I'm trying to troubleshoot with her. Marie, if that doesn't work, maybe you can put your questions in the chat and somebody can read it.
So that's what we'll be doing, Padmore. We'll be having updates. This is not just your only platform for right now. This is going to be something continuous.
Yes,
we'll be collecting data between now and January 8th. So hopefully we can step back as a forum and continue to exchange information on what's going on in Grant Houses and the whole West Harlem.
Absolutely, and by then I should also have more information in terms of mechanisms of us making sure we're getting feedback from the community, different things that we're doing in terms of getting messages out, because we want to create palm cards and different things like that. But I also, before I leave, I just want to stress is that the intent is to be able to give individuals accurate information as possible, so that they're making informed decisions, so that when they have a conversation with the family, and it's not to say that because your neighbor gets it, you should get it, or your neighbor does not get it, you should not get it, that you heard your neighbor say this and that, that getting it from this particular website that you're not too sure about. What we hope to be able to do is to give you a space where you can come and feel comfortable in terms of getting as accurate information as possible. Of course, the information is changing, and we're going to be setting up mechanisms so that folks are being updated as the information is changed. But I think ultimately the end point is that you feel comfortable making a decision one way or the other for you and your family. And everyone's family is a little bit different, whether you may have, a multi-generational family, some family members that have underlying conditions, whatever it may be, but just to be able to have that discussion with your family and be able to say, this is the way we want to go.
If I can just mention one thing, is that, the flow of information, it's great that this is an available resource, this community radio station, and Grant Houses is really, really lucky and blessed to have this. But for other communities, I know that you have a YouTube channel. I know that you're doing a lot in this area. But will there be some kind of one point where all this information is directed so that everyone is able to, even at Grant Houses, is able to use this information, because there are so many things happening on the everyday for families right now. Is there, for example, a one day that that communities can say, okay, at Grant Houses, whether it's online or if, by that time we're able to do something in person, is there kind of a one-stop place that people can go to for information? But what the YouTube channel you have is fantastic, by the way. But how are people beyond this stream able to access this information? Because it's very valuable and useful. I'm part of the Wiki community. We'd love to help with that. I'm with an organization called AfriProud that's working with iStock and Stu, who is also on this call, Digital Divide Partners, to improve access to information on this in what ways we can. But what would you say is a great place for people to kind of direct themselves so they can get access to this information and use it for their families right now?
Thank you for that. That's a great question, great point. So, and I know we'll be working together with CARLTON and the radio station to make sure that the information is accessible. But I put a link in the chat. It is basically the New York City Department of Health's COVID-19 vaccine page, and that's where, if nowhere else for you to go, you can go there. It's constantly being updated for all the information, all the different mechanisms that are going to be in space and in place and developed to allow this bi-directional communication with partners, with the communities. I think one of the key things also is that there are a lot of folks who do not have access to the internet, or it's spotty. There's a lot of different connectivity. So we're also going to be trying to do creating palm cards. We also want to be doing is training individuals who are, who will want to speak to others in the community.
Yeah.
So that's another thing that the Department of Health will be doing. And many of you may have heard there's something called a Vaccine Command Center recently that was stood up on Monday. That is basically going to be the mechanism by which the city overall looks to get all of its information out to the public, as well as to gather feedback from the public about what it's doing right, wrong, and how it can improve. So there will be online methods to get access to that portal, and I'll definitely be happy to share that. I have also put my email in the chat so that individuals who want to reach out to me directly, CARLTON has my information. Want to try and ensure that some of that information that is being created is being channeled to you, knowing that you have also access to various populations within our community. So happy to make those partnerships, and this is what this is about. It cannot be done by one agency on its own. It has to be a full-hearted, coordinated, collaborated effort with partners, and we want to make sure that partners have as much information as possible to be able to support that endeavor. Thank you so much, everyone. I do have to jump off now, but Carlton, you and we'll talk and just to kind of get feedback and also see how we can be much more informative going forward. Laureen is also a great resource. I definitely, we want to be able to again engage in being able to give out PPE and give out information as we including some of the information around the vaccine. So I guess at some point, probably in the new year, we'll be trying to set up another Get Tested Tuesday, or a Get Tested Day, or even just giving out PPE in the general area by grant houses.
Yeah, absolutely. And any outreach events, I've put my email out there. It looks like our folks, DOH and with the New York City Health and Hospital Test and Trace Corps, we're going to be working really closely with the Department of Health on some town halls and upcoming events. So, you know, in New York City, we have so many diverse cultural communities, and so we want to make sure that we engage folks at where they're at, not just ask them to meet us where we're at. So there'll be many facets in order for folks to get this information.
Padmore, just one quick thing before you jump off.
Sure.
Can you still hear me, Padmore?
Yes.
I was just thinking down the line as we start the vaccinations, if Department of Health could do something like we do for voting, a sticker would say, "I was vaccinated today. How about you?"
That is in the works. It is actually.
Someone stole my idea. Okay. I just think that would be good. When I see people with "I voted," it kind of rings a bell. And if you get younger people that have that on, that say, "Okay, it's not that bad after all."
Yes.
Great.
All right. Thanks all. Have a good evening.
Thank you, John.
Thank you, Padmore. So, Stu, how much time we have?
We have just spent about an hour and 15 minutes, so maybe another 5 or 10 minutes and start to wrap it up.
Okay, so what we're going to do from henceforth, I mean, this forum here, our next streaming, when we get enough residents to get on board, so we can collaborate between the North, West, and South, and the East Side. We're going to get all four corners, and we need to get information out from all four corners to each other. This is what this is about, us connecting together and using this communication at a level that they're not going to even understand it. It's I stated before, it's going to be hard to explain, but this kind of cross communication on all four corners, we'd be able to help each other out, be able to keep a lot of temptation down. That's not too, far-fetched. There's a lot of temptation where not to wear your mask. And as Padmore John said, coming from the youth. As Dr. LaFond said, coming from the youth. You got a lot of youth out there that, it don't affect us. We immune because they heard that. It was all on the news. Oh, the kids, they fine. Nah, the kids, everybody, we all got to arm up and mask ourselves. We all need to shield ourselves. And we do have Lorena. Is that?
I think she dropped off. I don't see her on the.
Oh, she out there? Okay.
Yeah, I think she dropped off. Yeah.
Okay. So basically, the information that I speak, the questions that I ask, is straightforward, straight from the heart. This is coming from people inside of grant houses and asking me to put this kind of questions out to be subjugated, and people, can understand the different wave of dialect that we'll go through because I receive it from people who speak of different, dialects, college, street, intelligent professors and doctors So you're going to hear that kind of stuff, and you can easily pick out what we're talking about and say and grab hold to something this subject. That's why I mentioned about vaccines and treatment. You know, because I know in one of those two we could put both of them together. As you notice, Padmore John read out the presentation. He had it where he could just sum it all up. He didn't have to piece and peck at it, you know. And that's the way we're going to function. And it's raw. It's raw. There's no script or anything. It's just coming straight to you live from Grant. It's coming straight to you from Streaming You Projects with Stu Reed. And this is very serious because our future is at hand. Our health is at hand. And we really got to figure how we can improve ourselves better than what we are now. We got people doing great. Well, we need the whole entire global universe to do great.
Mm-hmm. Yeah.
Carlton, would it be helpful if we were able to get some of the other forum board members like Margarita Osario from Amsterdam Houses and Polly Spain and Diana Blackwell and get them roped into this?
Yes, everybody gonna be roped in. This is not the last of it. We ain't even begin yet. Right now we got the initial group that can actually disseminate the information. Department of Health, with Padmore John and Lorena, Ms. Valentine.
Yeah.
They from the Department of Health. We can also bring in others. We know some doctors and stuff that we can get from Mount Sinai and have them participate.
Yeah, definitely.
Carl, I also just wanted to quickly introduce Greg Shatton, who is the president of our local chapter of the Internet Society in New York, who has kind of worked in the background to help make a lot of stuff happen. Greg, you want to say a quick hello? Come in, Greg. There he is.
Hi. Sorry to be late. The day job kept me. In any case, so glad to jump in. I was listening for a couple minutes there. This is, incredibly important stuff. I'm glad that the New York chapter of the Internet Society can help in some small way. Look forward to some bigger ways in 2021. Like everyone else, COVID's got us down, but not out.
That's right.
And it's certainly an opportunity to test a lot of things, including your sanity, but also to show, how important connectivity is. And so many more people are talking about connectivity and the necessity for connections, and also about underserved communities and the necessity of this as a utility service, not a luxury item or a wonky scientific experiment as it was even before then. So that's a good thing. Maybe one of the good things to come out of COVID will be the idea that everyone needs an internet connection and they need to be able to use it, because connectivity is, only half the battle. And I know that, Stu, among many others, but I'll say Stu, has been working on making sure that, when he assists communities with connectivity, he's giving them something to connect with and something to connect to and something to connect about, and not just a raw line to the internet. So, that's both halves, at least that's two halves of the battle there. Content, connectivity, concept, and coherence. And I'll keep listening and mentioning words until I run out of them, which I just did. So in any case, I'll having now interrupted you, I will de-interrupt and listen, which is I'm actually pretty good at. And if there's anything else I can contribute for any ideas for things that we can do in 2021, we can keep running programs. We can look to do other things, leverage other things. All critical stuff. And as a lifelong New Yorker, this and and I wouldn't say internet pioneer, because I've only been, deeply involved for about 15 years in internet policy and attempting to make things change. But anything we can do. The Internet Society itself was founded by essentially the people who founded the internet. People like Vint Cerf, who were, just about in the room when one computer was first linked to another, and when one computer in a room was linked to another in a room at a different place. These are, so the Internet Society, stands at the heart of the commitment to an open and free internet for all. And happy that we can stand with you and help make that part of your reality. Thanks very much. I will now return to listening mode. Back
Thank
to
you, Greg.
Well, that was a great presentation for yourself. It was great to hear you, Greg.
Thank you.
Carlton, I have a question following up on Greg's piece there for Greg and for Stu Reed.
Yeah.
In the past, the community board has heard of issues with connectivity and internet access in some of the NYCHA developments because of the brick and mortar that they are made up of. Is that still an issue to your knowledge?
It's still an issue, but right now I'm doing linguistics, and I'm studying to NYCHA Regs 964. So it's going to be something in there where it may tap on and connect and create that nucleus that I always talk about, where a certain language can come out and it'll be agreeable with NYCHA, if you understand where I'm coming from.
Somewhat, but my question more was based on, we have students that are working remotely, and
Right.
in the past we've heard that they're having connection problems with their laptops or tablets or whatever. So, based on two gentlemen experts here, I was just, and that applies also, not only for school, but getting information out like we have right now. I was just wondering if that's still an issue within the housing NYCHA developments as far as connecting to the internet.
So
We are still working on our group, Streaming University and Digital Divide Partners. We are still working to expand the free Wi-Fi service that we provide, at Grant, at Johnson Houses, and other locations, public housing locations. The challenge, Victor, as always, is money. It costs money to expand. The Internet Society Foundation has been helpful in helping to support what we're doing, as well as others. The community, the resident association themselves have helped finance most of what we've been doing over the last 5-10 years.
Okay.
So we're looking to expand that. We're also looking for other sources for funding. We've got lip service from the city. I don't know what they're going to do. They've announced things and then they pull back. I don't know what's going on with that. But we're certainly looking under every rock and stone for financing to help expand what we're doing, because we think there should be free internet access throughout all of NYCHA housing. And we're also working, in addition to CARLTON and a couple of the people that were mentioned, that you mentioned, we're also working with the chair of Manhattan North, Ms. Velez. Yes, to help secure funding to bring service to her entire district. So it's a big undertaking, but it's something that we are dedicated to, and we're not going to quit until it's done.
All right.
I want to step back for a second and add a couple of things to that. Part of the question, or part of the answer to the question, is how is the connection to the internet being established? So that is a big part of the issue. A few housing projects have been fortunate enough to work with Stu and his team on installing Wi-Fi systems within the buildings. There are a couple of other organizations that are also working to put free or low cost, mostly low cost. Stu does free better than anybody, but low cost connectivity into some other projects. But in other places, it's just the same options that I have: Verizon and the cable company. And then lately there have been some stuff floating around. And then there's NYC Mesh, which is a community-based, more do-it-yourself situation, where you can, hook up to their wireless mesh network, which requires you to be adjacent to other networks. And so that's the problem, is there's the old-fashioned monopoly or duopoly of the cable guys and the phone guys, and then other things that can be offered, and then some way to bring it into the house, if it's either cable, router, the DSL through the phone lines. I know that sometimes social services agencies will solve this by bringing in a wireless hotspot. That's obviously a very one-on-one solution, but my wife works with disadvantaged population, and that's one of the concerns they have, and sometimes they have to help solve, is getting that connection into the apartment, and then making sure that there is something other than a phone to use it on, because it's hard to do your homework on a phone. And if there's only one device being shared by a family of several people, that's also an issue too. So there's a whole stack of issues, but the last mile issue is really the classic part of this. And there's still there's no great universal solution. There's some discussion of New York having its own community Wi-Fi, which of course has been thought about for decades and squashed by the duopoly for decades. No surprises there. So that's, when you're asking the question, how's the Wi-Fi connection? It's like, where are you talking about? A place where Stu has managed the last mile, a place where NYC Mesh has put in some last mile, a place where somebody else has, or a place where everyone else is just subject to market forces, which means, too little service for too much money.
Well, Victor, if I could just put a summary on what I think and my position, not just mine, but Doug and the people that we work with. What we have found is what works best is when the community themselves take control of the problem and start to provide their own connectivity. That's what we have seen work. Not looking for a handout from somebody else, not looking for the monopoly to do the right thing, because we don't believe they will, but for the resident associations and the community groups to work together cooperatively to provide the service. And that's the path that we're moving. That's the path that we're moving. Yeah. So I'd be happy to talk to you further offline, Vic, if you have some ideas about how to help make things go. I'm talking to CARLTON, been working with us daily for the last couple of years and helping to move this thing forward. So please reach out to me and Doug, and let's get our heads together and see how you can help with that effort.
Definitely. Now wear many hats.
Yes.
I'd like to mention that for the education project that we've been working on, we just had a meeting with the librarian community as well, and CARLTON was in the meeting, and thank you, Stu, for all your support and everything. It looks like there are some good possibilities there as well. So hopefully we can see what's possible and do some more.
Great.
So I know we have two different situations here, especially with connectivity. For those that do have internet service and stuff, we're losing signal strength here in abundance. We have people that have the new Wi-Fi routers and I believe repeaters that can absorb your internet signals, and that's one problem we have. For those who are looking to get into the free Wi-Fi stage, as I stated before, there's a certain language that is being spoken, and that's been working so far, especially in my case, because when I speak, we have to go to almost defining points, and we start getting into the core and the nitty-gritty of what we're talking about. Some people conversate and they elaborate on an outer shell. I go into a core and I disperse myself outward. My language is dispersed outward. It's something that we can forget about it. If we're going to change, I can't change it, but we do get results, as Mr. Stu Reed and Doug Frazier do know. The certain language I speak, we get great results. We get great turnouts. We get people that's interested, because from wherever I'm doing, I'm coming from an angle where it seems interesting, and they want to see it happen. So we got to just show people more than we talk about it. What I got in my head, I could talk about it, but you won't have to watch it be worked out. And it's great when all of us is there, because Stu and all us, Doug Frazier, when we went into that old room, and after it was all done, Mr. Patterson and everybody participating, that was a new place when we came out. That place was dilapidated, and basically Department of Education and Health dismissed that place from lunch meals and everything. We were able to turn it around. So, like I said, it will be in the language. This language will be spoken very soon to a few people in management, and we'll see if we can extend free Wi-Fi, and maybe we can get into the internet service once they see the Wi-Fi is being connected. The whole place is a test bed under research. We might can start doing all public housing in that manner.
You're tuned in to GHCR, Grant Houses Community Radio, the soul of the Upper West Side.
And that's basically, I got two of the top guys, tough cats in my corner. I'm ready to go 25 rounds if we have to. So, we just gonna see in the upcoming weeks when the stewardship campaign takes effect, and we able to be in the buildings, on the floors. That's where you can start dropping information, something they can touch and feel, and then be able to get online and be able to see what we're giving to them, what we're leaving at their door. They get to see what we do. It'd be a connection that is very unusual, but it is, I believe and have faith that it will occur a whole lot of curiosity once it starts.
Okay, we're kind of it's about 6:30. I think we'll just kind of get some final comments and wind things up. Do you think? For me, I just want to say that this has been very positive. We've been recording this session. We're going to share it with all the participants. It's going to be on multiple websites. Safeandsmart.org is where we curate a lot of our community content. A lot of the stuff that we're producing at Grant Houses and other public housing locations. We have another studio at Johnson Houses. So that's the website where this is going to be located. I'll send that link out to everyone. And hopefully, Carlton, we can do this again maybe sometime next month.
Yes. Like I said, once the 8th pass in, hopefully we be already in the buildings collecting data.
Yeah. And
we'll be able to transmit that data from Grant to Johnson, from Johnson to Dykeman, and everybody in between, all the agencies and institutions, to be able to get a grip on what they can't see. They can see it now. You be more than just talk about it. Plus, you can come in and have your inputs in, creating a larger nucleus.
Mm-hmm.
That would be great.
All right.
Okay. Any final comments from Victor? You want to wrap anything up?
I just want to say the community board is at your disposal for everyone here. I'll work with you guys closely, ladies, and try and get this word out. Maybe we could do something at one of our meetings. We could hold a forum at one of our meetings to bring more people in. We have a health committee. Maybe we could do something with them to get the word out even further.
Mm-hmm.
So, but just glad to sit in and absorb a lot of the information I heard this evening here. Thank you.
Thank you.
This was great.
Dr. Norm?
Thank you all.
Thank you very much. I only have one question. Why does Greg have a backdrop which is in front of my building?
Because I grew up on 101st Street in Central Park West.
Because that's Audrey and I live on 100th, and that's the corner of 100th and Manhattan. That's the bodega over there. So I was curious why you picked that one.
Exactly. Well, that's where I used to buy my comics when I was a kid. When the candy store on Central Park West didn't have the books I wanted, I go around the store to the bodega. Still remember buying comics for 12 cents, which dates me. But that's where I grew up. The garage there was where my parents parked their car. The Seatown or Met Foods or whatever it is these days, Associated, is where we shopped. So that's my place. That's my home.
Oh, all right. Well, terrific. Just it looked very familiar to me, and I said, "Wait a minute, I've seen that before."
Really odd. My goodness.
Yep. It's a small world.
Okay. CARLTON, final words. Final words from our commander, Mr. Davis.
I'm gonna get with you and hopefully set a date for the next meeting. Like I said, I want evidence, not just with COVID-19, but how we can clean up the West Side. Citizen app, get conversations on that. Night show, all the streets are being showered down. We need a team to shoot all up and down, do a street washing. Just help some local stores, clean in front of their area. We got a lot to put together, so it's going to be definitely soon. I'm going to put up all the information and I'll send it to you.
Terrific. Thank you.
Well, thanks everybody. This has been Grant Houses COVID-19. Some answers. Thanks for tuning in.